You wake up in the middle of the night and your hand feels strange. Maybe it is tingling. Maybe your fingers feel heavy or numb. Maybe it feels like pins and needles, and you have to shake your hand for a few seconds before the feeling comes back. At first, it seems harmless. You tell yourself, I probably slept on it wrong, and sometimes that is exactly what happened. But if your hands keep going numb at night after 60, especially if it wakes you from sleep again and again, your body may be giving you a signal worth paying attention to, not a reason to panic, but a reason to notice. Because nighttime hand numbness is not always just aging. It can sometimes be related to pressure on a nerve, blood sugar changes, vitamin issues, arthritis, inflammation, or even something happening in the neck. And one of the most important clues is surprisingly simple: which fingers are going numb? Many people over 60 describe the same pattern. They fall asleep normally, then wake up with one hand tingling. They shake it, open and close the fingers, move the wrist around, and after a short time, it improves. That quick improvement can make the symptom easy to dismiss. But when it keeps happening, the pattern begins to matter. A common misunderstanding is that numb hands always mean poor circulation. Circulation can be involved in some situations, but many nighttime hand symptoms are actually nerve symptoms. A nerve is like a communication line between your hand and your brain. When that nerve is squeezed, irritated, or not working normally, the message can become distorted. Instead of normal feeling, you may notice tingling, numbness, burning, aching, or weakness. At night, this can happen simply because of position. Many people sleep with their wrists bent, their hands tucked under a pillow, or their elbows curled tightly. If a nerve is pressed for long enough, the hand can fall asleep. If this happens once in a while and goes away quickly after changing position, it may be nothing more than temporary pressure. But if it happens often, affects the same fingers, continues into the day, or starts to come with weakness, it deserves more attention. One of the most common explanations is carpal tunnel syndrome. In carpal tunnel syndrome, the median nerve is compressed as it passes through a narrow space in the wrist. This nerve helps provide feeling to the thumb, index finger, middle finger, and part of the ring finger. So if the numbness is mostly in the thumb, index finger, middle finger, or the thumb side of the ring finger, carpal tunnel may be one possible reason. Many people notice it more at night because the wrist can bend during sleep, adding pressure to the nerve. Some people wake up needing to shake the hand. Others feel symptoms while driving, holding a phone, reading a book, cooking, or gripping tools. After 60, this becomes especially relevant because carpal tunnel can overlap with other health issues, including arthritis, fluid retention, diabetes, thyroid problems, kidney problems, inflammation, or extra pressure around the wrist. That does not mean numb hands automatically mean carpal tunnel, but it is one of the first patterns to recognize. A different finger pattern can point toward a different nerve. If the numbness is mostly in the ring finger and little finger, especially after sleeping with the elbow bent, the ulnar nerve may be involved. The ulnar nerve runs near the inside of the elbow, close to the area people call the funny bone. When the elbow stays bent for a long time, that nerve can become irritated or compressed. The result may be tingling or numbness in the little finger and ring finger. So a simple way to think about it is this: thumb, index, and middle finger symptoms may suggest pressure around the wrist. Ring finger and little finger symptoms may suggest pressure around the elbow. This is not a diagnosis, but it is useful information to bring to a healthcare provider. Another possible reason is diabetes-related nerve changes. Many adults over 60 live with diabetes, prediabetes, or changing blood sugar patterns. Over time, high blood sugar can affect the small blood vessels and nerves. This can lead to peripheral neuropathy, where nerves do not send signals normally. Diabetic nerve symptoms often begin in the feet and legs, but they can also affect the hands and arms. The feeling may be tingling, burning, numbness, pain, or reduced sensation. So if someone has diabetes and starts noticing recurring numbness in the hands, especially along with tingling in the feet, balance changes, burning pain, or reduced ability to feel touch or temperature. It is worth discussing with a clinician. The hands may be giving a small signal about a broader nerve health issue. Vitamin B12 is another piece many people overlook. B12 helps support healthy nerve cells. As people get older, the body may absorb B12 less efficiently from food. Some medications can also affect B12 levels over time. When B12 is low, symptoms can sometimes include numbness or tingling in the hands and feet. It may also be linked with fatigue, balance problems, weakness, or memory changes. This does not mean everyone with numb hands should simply start taking high-dose supplements. A safer step is to ask your doctor whether B12 should be checked, especially if the numbness comes with fatigue, balance trouble, memory concerns, or a long history of certain medications. That conversation matters because the right answer depends on your medical history, your diet, your medications, and your lab results. Inflammation and arthritis can also contribute. When joints, tendons, or surrounding tissues become inflamed or swollen, there may be less room around nearby nerves. In the wrist, that can increase pressure where the median nerve passes through. In the neck, age-related joint changes can sometimes irritate nerves that travel down into the arm and hand. This is why numbness should not always be treated as a hand-only problem. Sometimes the signal begins at the wrist, sometimes near the elbow, sometimes in the neck, and sometimes it is connected to blood, sugar, nutrition, inflammation, or a combination of factors. That is what makes nighttime hand numbness after 60 so confusing. The symptom feels small, but the possible explanations are different. So instead of trying to guess, pay attention to the pattern. Notice which fingers are involved. Is it the thumb side of the hand? The little finger side? One hand? Both hands? The whole hand? Notice when it happens. Only at night? While driving? While holding a phone? While reading? While gripping something? After your elbow has been bent? Notice how long it lasts. Does it disappear after changing position, or does it stay into the morning? And pay close attention to strength. Are you dropping objects more often? Is it harder to button a shirt, hold a coffee mug, open a jar, or grip a steering wheel? Does one hand feel weaker than the other? Weakness is important. Recurring numbness should be taken seriously. But numbness with weakness deserves medical attention. Also pay attention to symptoms beyond the hand. Tingling in the feet, balance changes, neck pain, arm pain, new headaches, walking problems, or changes in speech all change the picture. And if numbness appears suddenly on one side of the body, especially with facial drooping, trouble speaking, confusion, severe dizziness, chest pain, or sudden weakness, that is not something to watch at home. That needs urgent medical evaluation. For recurring nighttime numbness that is not sudden or severe, there are some safe, practical habits that may help you understand what is happening and reduce unnecessary nerve pressure. Try not to sleep with your wrists sharply bent or your hands tucked under your body. A more neutral wrist position may reduce pressure for some people. Try to avoid keeping your elbows tightly bent for long periods during sleep, especially if the ring finger and little finger are the ones going numb during the day. Take breaks from activities that involve strong gripping, vibration, repetitive wrist movement, or holding a phone in the same position for a long time. If you have diabetes, keep up with your regular care and mention any new numbness, tingling, burning, or loss of feeling. If you are over 60 and also noticing fatigue, balance issues, memory concerns, or tingling in both hands and feet, ask whether vitamin B12 or other nerve-related factors should be reviewed. And if you take medications regularly, do not stop them on your own. Bring your medication list to your healthcare provider and ask whether anything could be related to nerve symptoms, vitamin absorption, fluid changes, or swelling. That is much safer than trying to solve the problem with guesses. The big mistake is choosing one explanation too quickly. A numb hand at night does not automatically mean a stroke. It does not automatically mean blocked circulation. It does not automatically mean carpal tunnel. It does not automatically mean diabetes. And it does not automatically mean nothing. The responsible way to think about it is pattern, frequency, and progression. If it happens once after sleeping awkwardly, it may simply be temporary pressure. But if it happens repeatedly, wakes you from sleep, affects the same fingers, continues during the day, or comes with weakness, pain, balance changes, or other new symptoms, it is worth talking to a qualified healthcare professional. Your doctor may ask about the finger pattern, examine hand strength and sensation, review your medical history, consider your neck and wrist, and decide whether any testing is appropriate. The goal is not to frighten you. The goal is to catch a manageable issue before it interferes with your daily life. After 60, your hands are part of your independence. They help you cook, drive, button a shirt, open medication bottles, hold a phone, use a cane, write, type, and steady yourself. So when your hands repeatedly wake you at night, it is worth listening, not with fear, with attention. The main lesson is simple. Nighttime hand numbness after 60 is often a nerve signal. The finger pattern matters, the timing matters, weakness matters, and repeated symptoms should not be dismissed as just getting older. You do not need to diagnose yourself. You need to notice the pattern clearly and bring that information to a healthcare provider. That one step can turn a confusing nighttime symptom into a much clearer conversation about your health. If this explanation helped you understand your body a little better, subscribe for more calm, practical health education about the signals that can appear after 60.